Welcome to the Modern Patient Experience, a show about how U.S. healthcare is adapting to new patient expectations. I'm James Furbush, Director of Marketing at Access One, a company that empowers revenue cycle teams to help all patients effortlessly pay for care in full or over time. In each episode of this show, I interview executives from hospitals and health systems, physicians and nurse leaders, digital health pioneers, and others to better understand what it means to be truly patient-centric. The goal is to serve up new ideas, frameworks, and tactics that will help your organization give your patients the best clinical, financial, and operational experience. And away we go. Hi, welcome back to the latest episode of the Modern Patient Experience. James Furbush. It's been a while, but I'm excited to have our guest on today. She is Liz Presson. She is the CEO and founder of Pursuit, which is a consultancy in Brooklyn, New York that focuses on patient engagement and a myriad of other sort of services for the healthcare industry. Liz, welcome to the show.
Hi, thanks for having me.
Yeah. So Liz, I'd love for you just to start off, give our audience a little bit of background on you and more detail on Pursuit, because obviously that's really just a high level, I'm sure, of sort of what you do and what Pursuit focuses on. But I'd, love to hear, it's such a fascinating niche that your company is serving in the market. So I'd love to hear more about that.
Yeah, absolutely. So I started my career in the tech space. I first started working for startups, and then I migrated to a corporation called Digi International, where I was their director of marketing, really working with connected products. And by way of working at Digi International, I started working with some medical device companies and got pretty interested in medical devices and kind of how they were connected to the internet and how that was helping patients. And so I started talking about that kind of publicly, doing case studies, some public speaking. And I decided after a year of being the marketing director at Digi that I wanted to start my own business and go and work with some of these medical device companies and perhaps expand and work with some other technology companies in this space. So I walked into my boss's office at Digi International with my manila folder, and I'm quitting, but you can become a client of my business. And it was great because he was very open and that actually worked. So very grateful in that way. But that's how Pursuit was born. That was 11 years ago. And I, again, was really kind of in tech, and that medical device branch was there, but I didn't plan on being embedded in the healthcare industry. Really what came about is my work with one particular medical device company called Oticon Medical. And I was working on the bone anchored hearing line. So bone anchored hearing devices for people who are deaf or single-sided deaf. And we created this really thriving community of patients and a lot of parents who had kids that the product had helped. And that really inspired me. And I thought, this is the niche that we're going to go with. We're all patients to some degree. And seeing this community thrive and utilizing the technology that I had gotten to know so well to help this thriving community meant a lot to me. And so that's what we've been doing for the last 11 years. We work with pharmaceutical organizations, medical device companies, and different sizes of biotech firms all throughout the United States and some throughout the world.
Yeah, that's awesome. And tell us more about sort of the patient engagement sort of angle of Pursuit, because that seems to be a large role. What you do, I mean, can you give kind of examples of sort of when you do patient engagements with your customers, or what that looks like? Kind of just go into a little more detail on that.
Yeah, absolutely. So I'll give a couple of different examples. One is we work with a company called Viluma. They're in New Jersey. They are a pharmaceutical organization, and part of their business is in the ophthalmic space. So they focus on vision and products for vision. They came to us and really wanted to create a brand and a community to help educate parents on the risks of nearsightedness in children. So what we're seeing in terms of nearsightedness in children is that because of digital devices and spending less time outside, kids are not only getting nearsightedness more, but it's progressing faster. So we're seeing things like glaucoma, macular degeneration, retinal detachment in younger people. And so we created a brand called My Myopia. You can see it at mymyopia.com. And we really started creating content very, specific to parents learning about nearsightedness, the cause of it and what you can do to help slow its progression once your kid has nearsightedness. And, it's something that a lot of us are familiar with. I'm wearing glasses, you're wearing glasses. We know what that journey is like. And we first engaged by creating valuable content. And then what we decided to do, we did this during COVID actually, is we had kids who had myopia sit down with eye doctors who are myopia management specialists. And the kids could ask questions about their nearsightedness over Zoom. And those conversations were recorded. And you can see those on YouTube and on the website today. And so if you have a kid with nearsightedness or myopia and you're trying to encourage them to sit a specific distance from their screen or to read a book a little bit further away or to maybe go outside and play more so their eyes don't get worse. You can show them these videos of kids just like them having conversations with eye doctors. And so it's really about kind of taking the idea of valuable content to the next level. So that would be one example. And, others are physically bringing people together. For Oticon Medical, the company that I mentioned earlier with the bone anchored hearing devices, we would actually bring our digital community together in person once a year. So all of the different advocates could get to know one another. And it was really lovely to see little kids who had these pretty unique hearing devices meet each other for the first time. And then, again, mutually valuable experiences because we got to bring a video crew and create a lot of great content in that 2-day time span. And so that's what we really aim to do is create these patient engagement experiences that are both valuable for the organization and valuable for the patients we serve.
That's awesome. So how should, for, our listeners that are thinking about how to better engage their patients, how to better educate them, frankly, meet them where they might actually be hanging out, whether it's on YouTube or TikTok or wherever it is these days. But how should, audiences who are listening, be thinking about the use of sort of these digital technologies and in order to create better relationships and more meaningful relationships with their patients?
Yeah, I think it's really important. We get to the point where we're thinking of all of these different strategies for the different tools that are available today, especially as AI tools. Different AI tools are coming out every day, and everyone wants to create a strategy for a specific tool. But I think it's really important to kind of take a step back and to think about how we as humans utilize the digital technology in our lives. And so, what I really encourage the companies that we work with to do are to use digital technologies as communication tools for transparency, for information sharing, and for feedback collection. In the past, especially with the pharma companies that I work with, people maybe didn't know where their medication came from, and maybe they don't today, but there's a great opportunity to build trust as a brand, as a pharmaceutical company. There's so many reasons not to trust pharmaceutical companies, and that creates a huge opportunity to really come out and explain who you are and to be different. And then I think it's really important. I know, we work in a really highly regulated space, but there's still opportunities for feedback collection, whether that be through social media, whether that be through mechanisms on a website, or like I said, bringing people together in a virtual or physical domain where you can get feedback on your products. So that's, kind of going back to basics is what I really encourage organizations to do versus to have different strategies for each platform. You can have campaigns and tactics for each platform, but I think that kind of overarching holistic approach is what works best. And then, we can also think about how to use tools for systems for efficiencies. when we're using something like Zoom to run a focus group, we're creating an efficiency. And so those are the ways that I would encourage our clients and others to think about it.
Yeah, it's interesting. It's such a smart way to think about, fundamentally like building trust isn't necessarily about, it can be about the product, I suppose, but I think about this all the time where it's, you know, building trust is not about, say, promoting what it is that we do here to our customers. It's about trying to provide better information to help them do their job better or navigate whatever challenges they're having or things like that. And I do think like a lot of organizations still sometimes get that wrong, or they not that they get it wrong, but they like sort of they miss that aspect, which is really fundamental. That sort of like that these platforms are information sharing, email, YouTube,
Mhm.
whatever it is, are really about information sharing, not promotion. Are there things that you see kind of the customers you work with or the, companies that you engage, are there things that they do wrong or get wrong? Or what are kind of the common mistakes that you see companies who are trying to approach patient engagement with sort of these digital platforms? I'd love to hear more about that.
Yeah, I think that's a really good question because there is something that I see that happens over and over again. And that organizations will set out to do something with a purely altruistic goal, which is fantastic. I love it. That is great. But then business happens. It always does in business. It always happens. And so then the business starts to ask the team who had this really altruistic goal that the company wanted to achieve, they start asking that team, what has been the ROI? We know it wasn't the initial intention, but now we are at quarterly earnings and we need to know what the ROI is or what it's going to be for this project. And then everything shifts towards that. But you've built something that is just supposed to be, you know, serving. And so I see that happen over and over again because I think there's always the opportunity to build for mutual value. There's always the opportunity to build something that is altruistic and creates an ROI. And I think my company has gotten really good at doing that, but I think we need to get, you know, very honest with each other when these projects start. A good example of this is that I've worked on a lot of the clinical research websites that you might see pharma companies have, where they talk about the benefits of clinical research. And then they might also have a section where you can see the disease states that they focus on and the study details. Really, it's meant to act as an educational tool. And a lot of these, they bring in pursuit then to start promoting with digital advertising these education tools. And then the question quickly flips to how is this working for patient recruitment? But if we just build at the beginning and say, how do we educate and then bring people through the education journey to the study that could be best for them or a caregiver and measure that entire process, we get this really beautiful patient education and recruitment ecosystem that the whole entire organization can tap into. And these beautiful end-to-end analytics where I can say, hey, did you know this Google ad or set of Google ads generated this many patients for this study? And here are the locations that we impacted the most. All of that's possible if you're very honest up front about what you want something to do, both for patients and the organization. And so that's what I always try to do is, you know, whether it's just for ROI or just for a serving reason, let's bring those together and talk about how they can feed off of one another and how we can be really honest about the goals on each side.
Yeah, I feel like that's like generally such a struggle. I mean, particularly in marketing, but also probably in a lot of other businesses as well, where, if you're spending money, it's like, what is this going to get us? But do you have advice for people who are struggling with that? Like maybe they want to build a community at the hospital or health system, for instance, that, maybe they want to build a community for cancer patients, but how do we do that? And what's the ROI? I mean, what advice do you give to people who are maybe struggling with that, like how to make the case to their higher ups? Like, how do they bridge that sort of altruism and the sort of that business case? I mean, do you have frameworks or advice for that?
Yeah, I always think that the best place to start is by talking to the people that you're going to be serving. In that case, speak to patients and understand what are some pain points. And I can almost guarantee that those pain points that patients are having are, pain points on the business side too. And I think that's always the best place to start. It's, you know, it's time consuming and it's not something that you're going to be able to just kind of tick off a box and say, okay, I'm done after you talk to a couple of people, but it will give you the best outcome. And so that's typically where we tend to start. We usually inherently understand the business needs or at least the business needs of the season and can anticipate those. But I think it's important to understand, you know, what patients are struggling with. A friend and a colleague, Erin Moore, for instance, she has a new series on LinkedIn where she's talking about, she has a couple of her kids have different health issues. And she talks about just a day in the life of what it's like to get their medications and to coordinate with physicians and to coordinate insurance and things of that nature. And so you don't even necessarily, have to be talking one on one to someone to go and find patient advocates who are sharing their experiences. And so I think it's really important to be a researcher and an investigator. And then after you've done some listening and understand truly what your questions are, go and seek out conversations with those individuals.
I love that. Be a researcher and an investigator. That's just so perfect, I think, because I think that's kind of what I try to do as well, right? To approach it where it's trying to essentially kind of learn and share those learnings with other people. Yeah. And it's so crucial to kind of have that frame of reference. Who was the person that you had just mentioned? Sorry, I didn't catch their name. Sounds like she's got a fantastic series.
She does. Her name is Erin Moore, More. And the series is currently on LinkedIn.
Yeah. Okay. We'll definitely have to check that out for sure. Add a
And
link
the
to
way
it.
I actually know her is through being a patient advocate for her son. And when my team was working with Lilly to develop Lilly Trial Guide, which is one of those clinical research websites that I mentioned, the
Yeah.
education tool that I mentioned, Lilly was forward thinking enough to bring Erin on to help support the development of that program and of that tool. And so that's how we know each other. And that is another thing to think about as an organization. How do we bring the people that we serve into the fold where they're actually decision makers for the things that we're building?
Yeah, I love that. Yeah, I often wonder too, like how often patients are involved with the programs that get rolled out or the way that, it's it seems so obvious to say that, but I do often
Right.
wonder when, places are moving fast or people are trying to get their job done or do whatever that, you can have that oversight of like just taking that step to actually bring in the patients you're trying to serve and involve them with the programs and the things that you're trying to sort of do for them.
Yeah, and I know it can be hard because there definitely is some red tape depending on the type of situation that you're working
Yeah.
within. There can be paperwork, there can be HIPAA forms, things of that nature. But again, if you're wanting to work on something that kind of stands the test of time, it's an important step to go through. And also, we have so many tools at our fingertips, even and I'm thinking of a product that we work on that's a pharmaceutical product that's on the market. A lot of people are just in Reddit forums talking about it or on Instagram talking about it, patient to patient. And you're privy to seeing those conversations. It's not something to sleep on in terms of just seeing what people are saying. It's different levels of accessibility, certainly when it comes to patient involvement, but we all have that visibility available to us.
Yeah, that's awesome. Yeah, I'm curious, for you, the kind of going back to the COVID pandemic as a learning model for kind of building awareness campaigns.
Mhm.
Because I feel like too there was that sort of shift, particularly in healthcare, where all of a sudden it's like, oh man, we really have to make sure we have digital. Like a lot of health systems, for instance, just didn't have some of those digital tool. They weren't really leveraging them. It was like, oh god, telehealth
Right.
took off and Zoom calls and things like that. We've seen all those examples. And sort of now that we're on a little bit on the other side of it, or, at least a couple years now past, although we're still, it hasn't really gone away, but, curious, if you sort of what you have learned and taken away from that as a learning model for, you know, building sort of digital patient, engagement campaigns and things of that nature.
Yeah, I think, one of the things that came out of COVID the most as like a learning model for awareness campaigns isn't even so much, I think, about the digital tools, but I think I saw from pharmas a transparency from them that I haven't seen. And even after, at that point, working with them for 9, 10 years, they were really explicit about what the COVID vaccine clinical trials were going to do for other people. Your involvement, they were very specific. Your involvement will look like this. And here is the outcome we're hoping for. And then when those trials were done, they were sharing that information back with the people who participated and with the public at large. And in that time, it felt very natural. They needed something, we had never needed to fill clinical trials faster. And so they had to share that information in order to make this work. And then obviously there was the business side where it was a rush to get to the vaccine. But I think in that pressure cooker, pharma companies really did what I want them always to do. What's the value for you? What's the value for patients? What's the outcome? How long is it going to take? And then what actually happened? And so I think that to me is kind of the learning model. It's that transparency throughout the entire process. And I haven't seen it applied in that way since COVID, but I am continuously pushing for it because today, if I'm on my end, when my company helps these organizations recruit for clinical trials in the situations that we are, I don't want those people to put in time. There are lots of benefits of participation, but still, I think the results are the really interesting thing, right? We want to know what happened. And so I'm always pushing for that model when it comes specifically to clinical trials and that type of communication structure that happened during COVID.
Yeah, that's fascinating. I mean, I hope that there's just better transparency in general. And it's almost like when I hear you say that, it's also like sort of clear and simple communication, right? Like I think sometimes,
Yeah.
as a patient, right? I mean, like healthcare in general is a struggle to navigate, even when you have all of the advantages at your disposal, right? So I think about me, for instance, and it's like, okay, I'm a highly educated, upper middle class, white male, right? I have literally every privilege in the world that you can kind of name. And yet it is
Right.
still very difficult for me. But I'm trying to figure out my health insurance and I'm trying to figure out like, oh, is this doctor in network? Is this, if I go here, what happens if I do that? It is just healthcare in general is a very complicated industry to navigate when you are well off. And when English is a second language, when you don't have those same resources, it is tenfold more difficult. And so it's refreshing to hear kind of you talk about the importance of that sort of transparency and like clear and simple communication where, people can really understand very quickly kind of what they're getting into or what kind of that program is all about.
Yeah, exactly. And it's like in the COVID times, we really had to strip away the BS, and what a lot of times happens in healthcare is we use the red tape as a reason for all of the verbiage, right? All of the words. But what we learned through COVID is that we still were following the rules and regulations of healthcare, and we were more clear communicators. It's, if you use any of the AI tools like Grammarly or something when you're writing an email to check what you've written, it will strip a lot of what you've written away because it's just not necessary. And that's what I'd like to see with the way that healthcare organizations are communicating with patients. Let's strip away all of the extras because, like you said, even at the level of privilege that we experience, it's still so difficult to figure out what's going on, what's it going to cost, what's it look like, what are the next steps. And I think just simplification is what we need to do. And you know, with all the digital tools that are out there, we don't need to be looking at them as kind of what can we add on? What can we throw into our toolbox? How can we use these to simplify?
Yeah.
I
You
think that's
mentioned
the most important
Grammarly,
thing.
which is
Yeah.
like A plus would recommend to anybody. Do you have any other sort of tools that you would recommend for helping with some of that clear and concise communication? I mean, Grammarly is at the top of my list, but I'm curious kind of what's in your tool bag.
Yeah, I think Grammarly is probably at the top of my list too. I also think that I'm trying to think of some others. I mean, I also am finding some AI integrations that we're doing for some of our healthcare clients where we have, I believe it's called Intercom. I'm not sure if that's the name of the organization, but it's a pop-up that you want.
Yes.
You put in a couple of details about yourself and it will take you directly to the information you're looking for. I'm finding there to be some situations, especially when it comes to insurance, for that to be very helpful because with a few details, we really can put the right copay card, the right savings plan in front of you and help you get your medication at a lower cost. And so those integrations are very simple, they're straightforward, but they're extremely valuable to patients. And so I would say, those are other tools that I'm really all about right now is just anything that will make that access experience better.
Yeah, that's awesome. I want to switch gears for a quick second because you wrote something kind of coming out of the COVID pandemic. You wrote kind of this essay for, I think it was Business Insider, I believe.
Mhm.
And I gotta be honest, Liz, as a fellow writer, I was a little bit jealous. It's a fantastic kind of essay, first person essay that you wrote about sort of your experience with the pandemic. And it was really about sort of burnout, but really kind of reevaluating sort of, kind of your life trajectory in some ways. And so I will say I'll link to it kind of in the details in the notes because I do think it's like a must read for anyone. I really can kind of just give you the highest praise for that essay.
No, thank you.
But I'd love to just hear you kind of talk about that experience of sort of, because I know a lot of our healthcare partners, right? They've sort of had that same similar kind of burnout. The last 4 years have been really hard emotionally,
Mhm.
taking their toll. And I'd love to just hear you kind of talk about that experience and sort of what you've kind of learned. And, if you care to share, I mean, you don't have to, but, I'd love to just kind of hear that perspective.
Sure. Yeah, absolutely. I started Pursuit when I was pretty young and definitely had a lot of that hustle energy. It was also that time,
Yeah.
11 years ago, it's definitely the time of like startup culture, hustle culture, that kind of thing. And so when COVID hit, I knew that there was going to be a natural lull in business because a lot of my clients were focusing on developing COVID vaccines. And I thought that was, obviously the most important thing as well, but kind of stripped of some of my typically if business is slow, I'm public speaking, I'm on stages, I'm traveling, I'm doing things to drum up the business. And during that time, that was not a possibility. And so I was really kind of sat with my thought and this inability to use achievement as, you know, an internal feedback loop almost.
Yeah.
And So at first, what I felt was just kind of a void. And then it was the realization that I was pretty much constantly feeling burnt out from that cycle that I was perpetuating. And so what I've kind of come to, and I say this from a position of being an agency owner, and I want to make that clear because when people are healthcare workers and on the front lines, it's just a different ball
So
game that that I'm not a part of and wish I could innovate more. But from my end, what I needed to do in my position was to not take a vacation, not take a break during COVID, those kinds of things to feel better. But I needed to change the way that I was working. And first, that was some psychological things about this need to achieve, taking a step back from that. But then I needed to, what I took time on then during that time, instead of the public speaking and client work, was how do I make Pursuit a better place to work for the people who work for me and for myself? And so I really looked at some of our communication processes, the hours we were keeping, the types of clients we were bringing in, and decided to make healthier decisions. And that was really hard because Pursuit it's my baby. It's the thing that I've always loved and nurtured. And there were a lot of times when I couldn't figure out, probably lost a lot of good people who worked for me because I couldn't figure out why they didn't want to stay up all night working out with me.
sure.
So those were, it didn't take me until COVID to figure that out. But I think it was really just re-looking and re-examining the way that we work. And we were already a remote distributed company, but that doesn't mean we were doing so effectively. We don't Slack outside of specific hours. And if we do, it's a private message. And we have in our contracts with our clients the hours that we're available and how much notice that we require if something comes up. And we really try to have clear boundaries, kind of try to prevent that burnout from happening again.
That's amazing. So it sounds like, you've been able to kind of get back to maybe a healthier where you were previously.
Yeah.
Yeah, good to hear. Well, so, Liz, this has been fantastic conversation. Thanks for coming on. Where can listeners learn more about you? Where do you kind of go? Website, social? Where do they go to kind of learn more about you and Pursuit, or how to get a hold of you?
Sure. So our website's pursuitof.com. My email address is liz@pursuitof.com. We are, always interested in talking to organizations who want to be innovative digital leaders, and we're typically hiring. We are right now. So I'm always happy to have those individual conversations. And then social media wise, Pursuit is Pursuit of on all of the social networks. And I'm Liz Presson on all of the socials. So I'm, always up and willing to connect with people. So would love to hear from you.
Awesome. All right, Liz. Hey, thanks so much for joining, and can't wait to kind of follow your journey, kind of see where all these great projects you're doing. But it sounds like you're doing great work, and we really kind of appreciate all that you're doing for the healthcare industries. Thanks so much.
Yeah. Thanks for having me. I appreciate it. It's been fun.